Mr. President, it is possible this week that we will pass a budget agreement for the fiscal year that we're currently in. That year started October 1st and runs, of course, until the end of September in the next calendar year. And if we do reach that agreement, and I hope we do, it's going to give us some opportunities. One opportunity it will give us is to spare ourselves the possibility of this Congress failing to enact a new budget ceiling, to basically guarantee the full faith and credit of the United States of America. So we won't face that showdown. And also the possibility of a budget shutdown will be relieved by the passage of this budget agreement. Those are good, positive things for this institution and for the economy of America. But there are specifics that also need to be noted, because this budget agreement gives us a chance to invest in areas of our budget that sadly were going to be overlooked if we hadn't reached this agreement. This morning we had an extraordinary presentation by the National Institutes of Health. 20 senators came to hear the presentation about research at the National Institutes of Health and what it means to us. Dr. Francis Collins is the director, extraordinary man, a medical doctor who was given the task of mapping the human genome and did it. Did it in an extraordinary way, creating new information, new opportunities. A doctor from Mayo Clinic explained what that meant. It meant that we have now reached a point where we can map the genome of individuals, their DNA, and we can then make decisions on the appropriate prescriptions for illnesses and diseases they face. And in doing that, be more effective, save lives. That's what medical research can mean. That each of us will not only have a basic biography in our medical record, when we were born and some of the basic illnesses we faced, but also our individual map of our DNA, which will instruct doctors when it comes to treatment of cancer, if it should strike us, or some other disease. It's an amazing leap forward. It's a leap forward that would not be possible without medical research. But yet, in the past 12 years, we've seen a downturn in investment in medical research of more than 20%. More than 20%. And it's meant that a lot of researchers have been discouraged and have walked away and said, there's no future in medical research. What a loss. They don't make a lot of money, many of them don't, but they're inspired to do things that make a difference. And if they don't think we're going to support them with our investment in the NIH and medical research, they look in other places. So this morning we considered where we are. At this moment in time, the Senate, under the leadership of Senator Blunt of Missouri, and the Appropriations Subcommittee on Health and Human Services, has provided basically a 7% increase in funding for the National Institutes of Health next year. That's a good thing. Now, I'll say quickly that Senator Blunt cut a lot of other areas that I think in his bill need to have help. But I hope that he will stand tall and tough when it comes to that 7% increase as we approach this budget negotiation. The House, conversely, did not give such an increase to the NIH, but they increased the Center for Disease Control, which is a companion sister agency that's important for medical research. So we have a chance to come together on a bipartisan basis and to come up with a number that gives 5% real growth in spending at both the National Institutes of Health and the Centers for Disease Control. It'll pay us back many times over. Mr. President, most Americans say, what are we going to do about the cost of Medicare? Medicare is an important program to over 40 million Americans, and the costs keep going up. Two facts you should be aware of we learned this morning. 1 out of every $5 spent under our Medicare system, 1 out of every 5 is spent on Alzheimer's and dementia. If we could have a means of early detection, prevention, treatment, or cure, it would dramatically change the lives of millions of Americans and millions of families, and it would dramatically reduce the cost to Medicare and Medicaid of these horrible diseases. 1 out of $3 in Medicare is spent for the treatment of people with diabetes. If we put the research into finding cures for diabetes and can alleviate the suffering associated with that disease, it not only will help lives across America, but it will save us money in our important healthcare programs. Investment in research, medical research by the United States of America, has been the pillar for the world when it comes to looking to a better day for the people who live in each country. This BRAIN initiative, which was described to us this morning by the National Institutes of Health, needs to be funded. It's not adequately funded now. We've dedicated some $350 million to Alzheimer's and brain research. Sounds like a lot of money. It's about 1/3 of what the researchers need. They have that many opportunities waiting to be funded. Will they all succeed? No. But that's the nature of research. But each one of them, they find to be a good investment to lead us to the day of prevention, treatment, and cure when it comes to Alzheimer's. So, Mr. President, I hope that we can come together on a bipartisan basis when it comes to this budget. In this area of medical research, there's plenty of room for us to work together, and there's already been leadership shown on the other side of the aisle. We're going to help to try to move that forward, both in the Senate and in the House on a bipartisan basis. When you meet with people across my state, I guess many other states, and you talk about political issues, there are a lot of folks with some very strongly held opinions on one side or the other. But when it comes to funding medical research, I have found that this is the kind of issue that opens the doors. People of all political stripes agree this is a good investment for the future of America.